Hi, how are you doing? Today I'm gonna talk about kidney stone, or in simple medical term, we call it urolithiasis. Okay, so we'll be discussing clinical overview, formation of solid crystals and urinary tract, and what it affects. So it affects kidney, ureter, bladder. So I'll be discussing them slowly and gradually. But before that, I want to tell you that if a stone is present in kidney, we call it renal stone. If it present in ureters, then we call it ureteric stone. If it's present in bladder, we call it vesical stone. Okay. Right. So epidemiology is a 10 to 15%, more common in males. Peak age is 20 to 50 years. It has high recurrence rate. And what are the types of stones? So there are different types of stones. For example, calcium oxalate stone, which is the most common calcium phosphate stone we have. Uric acid, then we have stromal, which is infection related, and cystic is actually genetic related. Then we're going to talk about the pathophysiology. So supersaturation occur, nucleation occur, crystal growth occur, aggregation occur, and then it gets retained in kidney. And what are the causes? So low fluid intake can cause it, hypercalciuria can cause it, hyperoxaluria can cause it, hyperuricemia can cause it, and UTIs can cause it. What are the risk factors? So obesity is one of the top risk factor. High salt diet can cause it. High animal protein can cause it. And sedentary lifestyle can also cause it. And family history. Clinical features, so renal colic, like there will be severe flank pain, there will be hematuria, there will be nausea and vomiting, dysuria, and restlessness. Complications or hydronephrosis can occur, and infection can occur, like pyelonephritis can occur, renal damage can occur, sepsis can also occur, which is rare but severe. Diagnosis, so you can do urine, urinalysis, you can do, so you can check serum creatinine level, and you can also go for a non-contrast CT, which is gold standard. You can also go for ultrasound, which is safe. You can also go for X-ray, KUB, and how to manage it. How to manage it. So it depends on the size and location. So if it's less than 5 mm, then you can do conservative treatment. If it's more than 5 mm, then intervention is required. Medical treatment, so we can do hydration, we can give them NSAIDs, which is a pain relief. We can also give them alpha blocker, for example, cancellation. And if infection is present, then we treat infection. Prevention, so we advise patients to drink 2 to 3 liter water daily, like per day. Reduce salt, moderate protein intake, and we also advise patients to avoid oxalate-rich food, and we also advise to come for follow-up regularly. So the most common stone is calcium oxalate stone, and the gold standard diagnosis is non-contrast feeding. And the pain type is actually colicky pain, and the complication is hydronephrosis. So the conclusion is like kidney stones are common but preventable. So early diagnosis plus life modification equals best outcome. Thank you very much and bye.